Preventative care is one of the most powerful ways to protect your long-term health, helping you catch potential issues early, often before symptoms even appear. Now, staying up to date on screenings and annual wellness visits gives you the best chance of better outcomes and a healthier future. Joining us today to talk about how preventative care can make a real difference, we've got Dr. Devin Dykstra. He's a primary care provider with Trinity Health Medical Group. Devin, thanks for being here. We appreciate it.
Of course. Thank you so much for having me.
All right. So, that yearly checkup, a lot of people kind of put it off. Let's talk about how important it is to be seeing your doctor on a regular basis.
Yeah, absolutely. So important to come in every year and really talk about, making sure you're up to date on your regular screenings, make sure you're getting things checked like your blood pressure, your blood sugars, and making sure that you're staying in touch with your doctor so that they're in touch with your overall health.
Right, because the doctor's the expert, and when you see them regularly, then you kind of develop a rapport. They know you, and then talk about some of the screenings that they will refer you to, depending on how old you are.
Yeah, so your doctor will know your risk factors and your family history, and that will inform what they're going to order. So commonly, we're thinking about things like mammograms, colonoscopies, pap smears. And then based on your family history or your personal risks, there might be more in-depth testing that's needed.
Sure. All right, let's talk about the colonoscopy, because I think that one people don't really necessarily want to do. But that one's not only preventative, but I mean, you can find cancer early, right? And take care of problems.
Yep, and definitely not the best part of anyone's year or something that they're looking forward to. But really important, and it really is the gold standard when it comes to colon cancer. There are some at-home tests you've maybe heard of, but the colonoscopy is great because not only are you screening for cancer, but you can remove those precancerous polyps at the same time. Absolutely.
All right, so, and your doctor's the one who has to refer you to do those. So that's the important part too, is that you may not know you need the screenings, but you also need those referrals. Let's talk to that and other things that your primary care physician can find out for you.
Yeah, so putting in those referrals, getting you in with a specialist that you need, and then getting you up to date on lab screenings, things like your blood sugar, your cholesterol levels, checking your overall organ function as well.
Yeah, and talk about the relationships you build with your patients.
Yeah, and seeing my patients and getting to know them long term is the best part of my job. So seeing people from children and babies all the way up to the elderly and being there for them every step of the way throughout their life is just really the highlight of my day-to-day job.
I love that so much. All right, so one final call to people. What do they need to do?
I think if you're worried about something with your health or you're worried about your screenings, don't worry alone. See your primary doctor, and then make sure that you're getting up to date and working on things together.
And I love that you say that. Don't worry alone, because, sometimes we create these things in our heads that our doctors can just explain away. So make that appointment in your MyChart, or if you need to find a new primary care provider, trinityhealthmi.org.